course, this is October. This is Breast Cancer Awareness Month. So there are a number of facts that people need to be aware of. For example, 1 in 8 women will be diagnosed with breast cancer. That there are about a little over 200,000 cases, new cases, of invasive breast cancer per each year at this point. There are about 60,000 non-invasive, and it's important, that distinction is important to know. And in the general sense, most cancers can be broken down into invasive and non-invasive types. Obviously, the invasive type is something that's a little more concerning. If it invades tissue, it can spread. The non-invasive type, a little less likely to spread, a little less concerning in that sense, but every bit as much a health concern, every bit as much of something that needs to be dealt with and taken care of. And the last piece of information, and although we're doing very good things with breast cancer, still around 40,000 women die each year from breast cancer. But there is a lot of hope to be had. First off, the federal government, institutions like the Komen Foundation, they're raising money. Awareness is probably as high now as I've ever remembered it in my 20 years of practicing oncology. And it's gotten to the point, and women are proactive enough, and physicians are gaining enough knowledge, where there are 2.9 million women in the United States who are breast cancer survivors. Most of the times, or many times, treatment of breast cancer is what we call multidisciplinary type of approach, where you have surgery, radiation oncology, medical oncology, chemotherapy, all of those disciplines, radiology, pathology, genetic counselors, clinical protocol people, all involved in the management of someone's newly diagnosed or recurrent breast cancer. Most of the time, people, when they are diagnosed with breast cancer, there's some formal process by which a case is reviewed by all of these different specialists. Surgery is typically offered. Most of the time it's offered either in the form of a mastectomy or a lumpectomy. Many times radiation can be offered if required. Chemotherapy can be offered if required. Many women receive hormone therapy, things like tamoxifen, or things like letrozole, or Arimidex, hormones that people take to really help reduce the chance of developing a recurrence. So, I mean, these are the kinds of things that we're working on right now, and this is the approach that needs to be made by almost all cancer centers, and patients really have a right to have a multidisciplinary approach to all of their cancers, and then very specifically and especially for breast.